Hello, my name is Saris, and today we're going to be talking about IV therapy. So first, before we even get started in the patient's room, we're going to review our orders and identify the reason that we're going to be starting IV therapy. We're going to check our patient's allergies, most importantly, before we start. So when we get to the patient's room, before we enter, we're going to perform hand hygiene. We're going to knock on the door and introduce ourselves. Next, we're going to go to the patient and check 2 identifiers. That could be their name, their date of birth, their medical record number. Next, we're going to explain the procedure, tell them we're going to be hanging some IV fluids on you, and we're going to assess their readiness to start the procedure. We're going to know the patient's baseline fluid status, their vital signs, and their medical history. Next, once we've considered all that information, we're going to gather our supplies. So once we've gathered them all, we're going to have our IV fluids, our primary line, and we're going to put on our gloves. It's always good to just wash your hands before placing your gloves. Before we start any therapy, we're going to have to make sure that our patient's IV line is actually working. So we're going to get a flush, and we're going to take a look at our patient's IV. So we're going to ensure it's flushing with ease, and that when we flush, we're not getting any redness, swelling, or tenderness. We're not going to push it very hard, we're just going to push it gently and not against any resistance. When we see that it's working well, we can proceed. If infiltration is suspected, we're going to follow our hospital policy and obtain new access before we start, and do hand hygiene. We're going to perform our 8 rites of medication administration and ensure that the right medication, in this case fluids, is going to the right patient, and all of the checks that are necessary. So next, when we pick out a fluid, we're going to make sure that we bring one that is sealed and covered, and we're not going to use any medication that's already open, just to ensure that it's not been tampered with. So we open our medication, and we can, well, in this case fluids, and we're going to hang it on the IV pole. Next, we select our primary line. It's longer than our secondary, and there's no hook in there, so we just make sure we pick the right one. We're going to open it and do this whole technique aseptically. So there's a lot of little wrappers we're just going to remove. And before you spike the bag, you should always make sure to clamp, so that when you do spike it, you're not running all of your fluid onto the floor. So we're going to spike and get it ready aseptically, leaving the caps on. Our line is is clamped. We spike it, making sure that we're going in, and usually with a little twisting motion, we can spike our bag. We just give it a couple squeezes so we fill the chamber, but not totally, so we can see that it's dripping. And slowly open the roller clamp so that we can prime the line. And we can watch the fluid go through without any bubbles. You can let a drop or 2 come out, and you're ready to go. There's a place that you can hook up your line on the back of the roller clamp so that it doesn't touch the floor. This one's a little long, so I'm just going to put it there for now. Okay, so next we're going to scan the patient. We'll just scan it, scan the fluids, and once again do our 8 rites of medication administration. So next we're going to put our gloves back on, and we're going to clean the IV site once again with alcohol. Give it a scrub, use friction and twisting motion for 15 to 30 seconds. And without contaminating the tip, we're going to connect to the end. And at this point, your fluids are still clamped. Then next, we're going to calculate our drip rate per our order let's say it's 100 mLs per hour, we're going to have to figure out how much drops we should see each minute. And our drop factor can be found on our packaging for our tubing. This one specifically is 10 drops per ml, so that'll help us do our calculation. So we're going to figure out our drop rate and adjust our roller clamp to allow the drops needed to deliver the fluid at the given rate. And once it's running how we want it to, we're going to document, and we'll be finished with hanging our primary fluids. Next we move on to our IV push medications. So sometimes we might already have a primary line infusing and we want to give an IV push medication. So once again we review our orders for the medication and review the reason for the IV push medication. A lot of times this might be a pain medication, we could give IV push antibiotics, it just depends. We perform our hand hygiene once again, come into the patient's room, and introduce ourselves. We once again check the ID, check 2 identifiers, name, date of birth, MRN, any two. We're going to once again explain the procedure and ensure that they're ready to receive their medication. We're going to educate the patient on the medication class, indication, and the side effects, and perform our 8 rites of medication administration before giving it. So we're going to, let's say it's an IV push medication. You have the medication here, and a syringe and needle here. You can prepare this aseptically without gloves. So we can use a blunt needle to retrieve the medication from the vial. And our order will tell us how much we need to draw up, and the order will also tell us how quickly to push it. These medications are often given over 2 minutes, etc. We can recap it without putting ourselves at risk for being stuck. Twist it off, and we're ready to administer. Well, I'm going to leave this on for now as we clean our Y site. So before we even give it, we're going to make sure that these medications are compatible. We wouldn't want to give it and find out later when it precipitates in the line that it shouldn't have been given with our medication that's already hanging. So we're going to put our gloves back on, and we're going to clean our Y site before we administer. We have our alcohol swab, clean the Y site. And before we start with the medication, we're going to give a flush of saline. We're going to either pinch the tubing at distally, or we can apply a little pressure and kink it at the Y site. We twist it on, and we give a push. We're going to open our clamp and push it in, ensuring once again that there is no resistance, there's no pain, there's no inflammation, there's no swelling. Then once again, we take off the flush, clean it with the alcohol, and we're ready to give the medication. We're going to push at the given rate that we've been ordered. We give the whole medication. Let's say this one would be over 2 minutes. We're just speeding it up for the purpose of the video. Clean it again. You're going to flush it first, then cap it. Then you can leave your primary fluids running if that's what's to be done, or if you had to discontinue everything, you would discontinue. For the next step of this video, we're going to administer a secondary medication. So these medications are a little bit different. They're usually a smaller bag, and they usually run as a piggyback to a larger line. So we would have to select our medication, select our tubing. We would once again check our orders for our secondary medication, our IV piggyback, do our 8 rites of medication, explain to the patient, and any side effects, check for allergies, the standard for administration. We're going to open our secondary, and we can hang it on the IV pole. We can open our secondary line. And we have a little hook inside the secondary so that we can put our primary fluids lower so that the secondary will run in preferentially. Once again, going to clamp our tubing so we don't spill the medication. Open without contaminating the spike or the port. Give it a twist. Once again, we're going to give it a squeeze, fill it about halfway so we can see a drip, and prime the line. Once it's primed, we clamp it, and we will prepare to hook it up to the Y site on the primary at a higher level. Okay, so our secondary line is still clamped, and now our primary line is also running at this time. So we're going to clamp our primary all the way, and we can open our secondary. Now we're going to adjust the rate of our secondary line using the roller clamp on the primary. And once we've calculated the drops per minute and achieved that, then we're going to just let it run in for the amount of time that we're supposed to, and eventually discontinue it when it's finished. Now, if our orders for our fluids and for our secondary and primary fluids are discontinued, we're going to disconnect everything. So at this time, we would clamp our roller clamp all the way. We would disconnect from the IV site. We could clean it, flush it to make sure that any blood that might have backflowed is cleared. Clamp it, get rid of our flush, clean it once again, and we can use our Kuros cap or whatever the policy states for keeping our IV sites clean. All of this should be documented, and we're finished giving our medications. Thank you.